fellowship has become the life's blood of the division. We're immensely proud of the growth and maturation this fellowship has taken over the past decade. This impact on adult recon education mirrors the strides we've made here at NYU Langone in the area of clinical research.
The fellowship provides a full exposure for fellows to all aspects of hip and knee arthroplasty. We have a significant number of faculty who are committed to education. Fellows are exposed to all the different approaches as well as the technologies used to do adult reconstruction cases.
One of the great things about NYU's Orthopedic Adult Reconstructive Fellowship is the number of different sites that the fellows get to work at and the amount of different pathologies that they get to see throughout their course of year training. You get to go all the way from inner city Manhattan and the boroughs here at Bellevue Hospital, all the way to NYU Langone Hospital's Academic Tertiary Referral Center. The other strengths of NYU's fellowship program in adult reconstruction are the diversity of the different patient populations you will be taking care of. The different types of patients that you're going to see throughout your year set you up extremely well for a career in joint replacement, taking patients no matter where you decide to practice.
NYU Langone Orthopedics is one of the most unique environments to train and learn in the world. And New York City is a melting pot. You can see pathology and experience and cultures from all over the world here. There is an unparalleled level of variety of educational experience here based on the population we serve here in New York City.
So one of the things that drew me to this fellowship program was definitely the wide variety in terms of case distribution. I think we certainly get adequate volume here, but in terms of the case mix, there's a large number of revision surgeries, complex primaries, in addition to just run-of-the-mill standard primary hips and knees.
We use all the real technology that's available, so there are people here using imageless and image-based navigation, robotics, both handheld and robotic arm-assisted surgery, sensors, and so there's really a diversity of opportunity for you to learn, and therefore a diversity of experience that you'll get and of skills that you'll graduate with ready to use in the operating room for your patients.
One of the other great things about being a fellow in NYU's Adult Reconstructive program is the interaction that you have with your attendings and with the residents. Here at Bellevue, we have a large resident team that on a daily basis will interact with the fellow and defer to the fellow when necessary to learn more about joint replacement. In the clinic, for example, the fellows take a very lead role in mentoring our residents and teaching them about the nuances from basic to complex joint replacement procedures. We have a variety of educational conferences for the adult reconstructive fellows throughout the course of the year and at various times throughout the week. On a weekly basis with the fellows, we have Arthroplasty Indications and Preoperative Planning Conference. During these conferences, the fellows learn tremendous amounts about what it takes to operatively plan, book, and then execute procedures using a variety of vendors.
We have conferences every morning for an hour, Monday through Wednesdays, and those conferences are just a good way to help me conceptualize arthroplasty in a way that I just had never done. I believe it creates an amazing educational opportunity. We do these cases and then we come and discuss them, and then we're able to get into the nitty-gritty of why and how we did this.
Yeah, it's a very rigorous academic program with 3 conferences a week with a very well curated curriculum focusing on hip and knee replacement. The favorite part of my week is the Wednesday morning Adult Recon Fellow Conference, where we go over complex cases and kind of get really granular with how to treat these problems, these advanced problems that we have in hip and knee reconstruction.
So during the week, our time is split between morning conferences, usually 3 days a week, where we go over either interesting cases or the attendings give really good talks on different aspects of total joint replacement based on their specialty. As well, there's a lot of opportunity to do research with Dr. Schwarzkopf and being able to do really any sort of research project that you want to do There are several research fellows here that can help you facilitate your research, which definitely helps because we're operating for most of the day and in clinic. So having that support team really helps in terms of productivity.
So some more detail about our research center here at the Adult Reconstruction Division. We have a large research center here that we run. We are well funded. We have overall a clinical manager that manages our research center together with me. We have usually about 4 research fellows and a handful of volunteers, so we actually have a big staff. We have a backing of a full-time statistician and a full-time IT guy that helps pull data out of Epic. So we have a nice team here, very easy to do projects, and we're very prolific. We publish a lot. We tend to have a lot of presentations in ACAS and in the AOS meetings and all of the other smaller meetings.
We also have a very exciting program, which is an Orthopedic Innovation Center we established last year with Dr. Zuckerman and of course Dr. Bosco. We have a robust infrastructure for intellectual properties and a lot of ancillary services for incubators, as well as tech transfer that helps fellows with any ideas, any new innovation or invention they have. And I think it's a very great experience for fellows that have ideas but they don't know where to start.
We have extremely skilled people here who use technologies that vary. We have different techniques that everyone employs, and as a fellow here, you learn all of these different techniques, and we have heated debates about them sometimes, and it's actually quite fun to be involved in them. And we're all very collegial. We all get along with each other very well. Seeing that modeled in the faculty is actually very important when you train and learn, because that's something you can carry through into your own practice, and learning that you may disagree with other faculty about how you do things in your practice, but you can also get along with them really well.
I feel that working with fellows is an honor, not to be taken lightly or for granted. Fellows ask the most probing, complex questions, and they keep us on our toes at all times.
In addition to our faculty, we have an extensive network of fellows all across the country. This becomes an incredibly important resource for our fellows, not only during their fellowship year as they transition into practice, but throughout their careers, no matter what type of career path they choose. We like to call this the fellowship of the fellowship, and it is one of the most important aspects of the experience here. Thank you for taking the time to learn more about our Adult Reconstructive Fellowship Program.